David, pleasure to have you here in Berlin, first time. We are building the bridge between Berlin and San Francisco, Berkeley University, and the DUCAH initiative. And so when I was the first time at your university, I was very impressed about the speed you are bringing your research results to the market. And so what can we learn out of that for our Berlin initiative?
Well, first, we're very impressed with what is going on here, particularly through DUCAH and all of the collaborators that you have coming together. But what we also see is an opportunity to take advantage of what we've learned in Silicon Valley, not only through our universities and startup companies, but just the entire innovation ecosystem of how to fail quickly, innovate, and iterate as much as possible. And that is one thing that we know can be replicated and done here in Germany and in Berlin very easily. And we see it already with the wonderful companies that are here. So we envision that speed constantly getting better, and particularly if we can do it globally. So we can build this bridge between Germany and the United States. It will benefit both.
Okay, sounds very good, and I'm still impressed even about your products and your research results, for example, the Activate program. So could you give some insights into that program and to the idea of bringing that to Germany?
Absolutely. Activate was a program that was created in a time of need through the pandemic, but it was really addressing primary healthcare issues of how to use technology to bring data from an individual to a health system and back to the individual. And this is a global problem. It is a problem not universal or not specifically to the United States or any specific country, but a challenge that the entire world is facing. How you bring healthcare solutions, how you bring data, which we now have greater access to make sure that it's actionable as quickly as possible. So Activate as a model, we see with very strong evidence, very good research that has worked in the US. We think it's important to test that in other countries, and here in Germany is a perfect opportunity, particularly because it can be used to benefit the older adult population and the workforce that supports that population. Yeah. So we see that as a fantastic opportunity to test Activate here.
So great chance for us to speed up and take your results and experience to the German market, and even we could help to come over the barriers that might occur on regulations we have in another way in Germany as you have in the US. For example, often we hear that our data governance regulation is too complex to transfer solutions from the US to Germany. So what do you think about that?
Oh, we think it, rather than a challenge, we see it as an opportunity, because not only have we already gone through some of the challenges of starting a project and finding the problems, but now we can address those very quickly through DUCAH in the German environment. And furthermore, we already have the benefit of the expertise here to address those policy and regulatory issues. We think that's a model for not only Germany, but for the EU. And it's going to be an important issue that we can take lessons back to the United States with.
You are the first time in Berlin and first time at our DUCAH-Forum. So what's your impression?
Well, first, we're thrilled to be here. The German hospitality is fantastic, but we are amazed at how successful and innovative the DUCAH-Forum is on all levels, not only bringing together thought leaders and sharing their information, but workshops to help people talk through new ideas. It's a very successful program. A model will have ideas to take back to the United States.
So I'm very glad that we have the first funded project from the Sanatory of Economics in Berlin to go the first steps to build that bridge in the reality and transfer some of your very well experienced research projects. So I'm very happy to do this, and David, thank you very much for being here.
We're delighted. Thank you, Thomas, for having us.